To suppress and control the epidemics, countries must isolate, test, treat, and trace.
Testing, isolation, contact tracing, that's the message the World Health Organization had for every country to tackle the coronavirus pandemic. Some listened, others didn't. Some were able to turn the tide on the outbreak, others are still playing catch-up. The to-do list by the WHO intended to save unnecessary loss of life and ease pressure on medical infrastructure by stunting the COVID-19 spread before things got out of control. But who followed these recommendations and who went rogue? I'm Serena, and welcome to Foxtel. By taking decisive actions, China is now seeing the light at the end of the tunnel. On December 31st last year, when China reported the first case of the novel coronavirus, the government kept the WHO and the US informed of every step it took through direct communications and press briefings. In early February, when the US CDC confirmed the first instance of person-to-person transmission on home soil, President Donald Trump barred foreign nationals who had been in China in the past 14 days from entering the country. The move bought Washington time to prepare for what most experts saw as an inevitable onslaught from COVID-19. The time advantage could have been spent developing tests and hammering out a plan for a test and trace approach, but Washington seems to have missed the mark. In early March, health officials told lawmakers that only about 11,000 people had been tested for the virus in the US. By then, South Korea had already been testing about 10,000 a day. In fact, by the third week of February, Seoul had thousands of test kits at the ready. Contact tracing was also on fast track. Likewise, in Germany, as early as mid-January, a Berlin hospital developed a test and made it accessible to others. The government was testing people with known symptoms, few symptoms, and no symptoms. They were also relentless on contact tracing. On the contrary, the UK decided to forgo rigorous testing and opt for the so-called herd immunity. Contact tracing? Not that I've heard about there.